Welcome, everyone. I am Joanne Tate, for those of you who don't know me, and I am delighted to welcome you to Providence Healthcare's second virtual dialogue on aging session in the 2020 series. We were off to a great start with our first session and all of us adapting to this new way of connecting. You're now joining today from across the entire Lower Mainland and even further afield. We are pleased to be able to create this learning connection until we meet again in person. And goodness, I miss seeing each and every one of you in person. This is a very, very hard way of being, and at the same time, I'm so thrilled that we're able to create those opportunities of connection, because the human connection, this is what it is all about. Over the years, the Dialogue on Aging public presentation programs have continued to bring us together, bring together researchers, clinicians, other experts in the fields for engaging discussions on a wide range of health-related aging topics. We're including topics that you've told us are especially relevant to you at this time. And in this time of COVID and our pandemic, topics of today are incredibly important. I've enjoyed my previous conversations with you, and we've had discussions about the possibilities within elder care. And today I share with you that I absolutely will be continuing this work, this dedication, passion, and commitment. And if anything, this pandemic has highlighted the need for our vulnerable populations and the attention, the care, the services, the support, the partnerships, the funding that we need to truly change this healthcare system. So I am moving out of my Providence Healthcare roles that I have enjoyed immensely, bringing concepts like our dementia villages and our culture transformations like megamorphosis and such. And I'll be moving into a new executive director role that's newly created. And that is a leadership position with Vancouver Coastal Health, responsible for the long-term care, assisted living, and supported housing services, predominantly focused on our seniors and our vulnerable populations. So I am thrilled to welcome an amazing colleague of mine and someone who I continue to look forward to partner with, Maria Howard, the CEO of the Alzheimer's Society of BC. And as our valued partner in this series, I welcome exhibitors who have pivoted to be here through technology. And Maria will now moderate this session. Enjoy.
Good afternoon, everyone. I hope you can see and hear me okay. Thank you, Joanne, for your introductory words. And I must say, from the Alzheimer's Society of BC, we have so enjoyed working with you and your leadership at Providence. And while we will certainly miss you, we're so glad that you are not going far and not stepping out of the important sector that we are all here committed to support people living across the province with dementia and seniors and caregivers. So best of luck, but I know we will continue to be in touch. The Alzheimer's Society of BC is so pleased to be a partner with Providence Healthcare for the Dialogue on Aging series, and especially now that they're virtual. It's a great new opportunity to reach out and join conversations, and I hope people are looking forward to this second session. I know I am. The Alzheimer's Society of BC has a vision of a world without Alzheimer's, a world that really begins with a dementia-friendly society, a place where people feel safe, acknowledged, welcomed. And we know that in BC today, there are over 70,000 people who are living with a dementia. And so the ways that the Alzheimer's Society of BC are committed to developing that dementia-friendly society are really five really clear ways. The first one is we want to change the conversation, which is exactly what we're doing today. We're talking about dementia. We're talking about the myths and the stigmas and all the elements that are associated, and we are helping people understand how broad of a topic this is. But at the heart of it, though, we must always see the person first before we see the disease. We're changing the experience. We're ensuring that people who are living with dementia have the places that they can still continue to go, that they enjoy, that they want to be a part of. We want to make sure they have the support so they can still lead the life that they feel that they want to lead. We want to change the practice. We want to ensure that healthcare professionals and other professionals who support people living with dementia have the right tools and skills to ensure they are also increasing the experience for all. We want to change policy. We want to help people living with dementia raise their voice and advocate to the government so that the right policies and procedures at the municipal, provincial, and federal level are changed to reflect how we need the support. And we absolutely need to change the future, which is changing the way that research is being able to do their job and reach out and make a difference. And that really connects us here today. The society wants to ensure that researchers have the opportunity to connect with people who are living with the disease and understand the things that are important to them. But then we also want to ensure that researchers, the information and the knowledge that they're discovering and really beginning to know will make a difference is shared with people who are living with dementia so that they can put into practice and really, again, start to create that dementia-friendly society. We are so glad you're joining us here today to listen to Dr. Eli Puterman. And I think this is an excellent opportunity when we can learn from a researcher who has some really practical tips and resources and will help us think about how we are building a dementia-friendly society. Dr. Eli Puterman is an assistant professor at the UBC at the School of Kinesiology. And I hear that pretty soon he is going to be an associate professor with tenure starting July 1st. So congratulations, that's a pretty, it's a pretty big achievement. So we're really pleased to hear that. He is also a Canadian Research Chair with the Michael Smith Foundation for Health Research Scholars and has won a number of Young Scholar Awards through the School of Behavioral Medicine, the Academy of Behavioral Medicine, as well as international recognitions. Dr. Puterman research really focuses on the idea about a healthy lifestyle and an active lifestyle. And the fact that adults who pursue an active lifestyle demonstrate that during times of stress, that they show less physiological and psychological wear and tear than perhaps adults who are not as active. And it's a really key point to think about in time of pandemics and COVID-19 where we are today. This is a really important message to hear. And so we're really looking forward today to hearing from him and learn more about his research and some tips and resources for people who are at home, who are caregiving, who are living with dementia and other chronic health issues, and how we can continue to put active lifestyles at the forefront so our mood and our health continue to get the best daily support. So before I turn it over to Dr. Puterman, I'm just going to remind people that this session we will have questions at the end of the session. So I'd ask that you hold on to your questions, but near the end, please use the chat or the little right hand or the little hand at the right side of your screen to ask questions, and we will go from there. So welcome, Dr. Puterman.
Hi, can you all hear me? Hold on.
Loud and clear.
Perfect. And I will, beautiful, show this window. Hi, everyone. You can see the slides?
All good.
Perfect, thank you. Thank you for that lovely introduction, Maria. Thank you for this invitation from the Dialogue on Aging. This is, we've been collaborating, I think, for the past 6 months or almost, yeah, over 6 months in terms of collaboration in presentations when you supported the Healthy Aging seminar series that we put on at the School of Kinesiology, and I'm really happy to be part of this presentation and to be part of the series. So thank you very much to Mary Lou and Christine for inviting me. As was mentioned, my research area is on physical activity as a coping mechanism or as a coping strategy for dealing with high levels of stress in one's life. And there's no better time to be talking about this than during the COVID-19 crisis. I'm going to present some research on the idea of lifespan and health span. Just to, the word health span might not be a word that's very familiar to a lot of people. So I thought I'd just give like a little bit of where my head is at in terms of my research going forward, in terms of kind of elongating the period of time that we're healthy. And following that, I'll talk about some of the research that I have completed with family caregivers of Alzheimer's, patients with Alzheimer's. And finally, I will provide some tips, some resources on how to become a more physically active person during COVID-19, because it's a struggle for a lot of people, and it's a struggle even more for people who are currently vulnerable and for older adults. So when we think about the idea of health, we often think about how long are we living for? And we rarely conceptualize our lifespan as more than just how many years do we live, but how many years are we living healthily? And that really has become a major focus of a lot of research, is how many years do we live healthily, and how can we elongate or add more years of healthiness prior to the end of our lives? Because at the end of the day, we all do and have our lives end, which is some people are okay with it and some people are not. But it's about adding more years of healthy life before disease sets in. Trying to just switch to the next slide. So every year in the Lancet, there's an article that comes out about life expectancy at birth, and it gets updated every single year, and it looks at if you were born, so I'm gonna, if you look at the top left with the light blue, it looks at how many years, if someone was born in 1990, how many years would they live? Or how many years would they be healthy? And then how many years would they live to the end of the little light orange bar. So I'm going to show you a little bit of an example. So what they do in the Lancet is every year they update this article where they compare it to 1990 levels. You know, how long do people live if they are born in 1990, and how many years of health do they have if they are born in 1990? And then they project it. If people are born in 2013, how long will they live if they were actually born in 2013? So kind of giving us like an idea of what happens with those extra 23 years of history in terms of people's health and lifespan. So let's take an example for Japan. So in Japan, men on the left and women on the right, in Japan, if you were born in 1990 as a boy, you're more likely to live until the age of 76. And for a woman, you're more likely to live to the age of 82 on average. But the health span is different. So how many years do they live healthily, even though their lifespan might be till the age of 76 in Japan? How many years are they healthy without disease? And that is 68 years for men and 73 years for women. So what you can see here is that in 1990, there's a difference where for a man, you might be living until you're 76, but 8 years earlier, you're likely to start having disease. Whereas for women, there's a 9-year difference between the health span and the lifespan. Now let's look at what happens for people who are born in 2013. So people born in 2013, their health span, which is in black, for men, for example, they might be healthy until they're 71. So they've increased the number of years of health by 3 years, and they've increased the number of years of life by 4 years. So while they might be living longer, it's not really that they're living healthy for longer periods of time. In fact, the amount of years between health and the end of life is 9 years for those born in 2013 if they were men, and 8 years if they were born in 1990. So while we think about, oh, people are living longer, that does not necessarily mean that they're living healthily longer. Similar statistics in the United States, where the health span for men was 63 years old in 1990, and the end of life for men born in 1990 was 72. And it's changed a little bit for men in the United States, but you can see again that there might be an increase in 4 years in the lifespan, but only an increase in 3 years for men in the health span, and for women it's only 2 years of an increase in the health span. So again, you can see that lifespan is increasing, health span is increasing, but the amount of years with disease are pretty much the same, if not getting more. In Canada, we have similar statistics, and where there's a good 10 years, where there's a health span to lifespan difference. And I will just quickly, try to figure out how to mouse and play a video for you.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness. Change your future at makehealthlast.ca.
So in Canada, we've had this campaign, the last 10 years campaign, for the past few years from the health agency. And it shows that we understand that there's this 10-year gap and that there's a need to improve the health of Canadians to live longer, but to live longer and more healthily. There were some ads that were put together, and they're pretty smart ads where someone's either kayaking or they're in their hospital bed or fishing versus with their IV bag. So it's an interesting ad campaign called Make Health Last, and you can visit some of their information from the Heart and Stroke Foundation. On the Heart and Stroke Foundation's website, they identify some specific lifestyle risk factors that, if not taken care of, will lead to an unhealthy last 10 years. So there's the unhealthy diet, physical inactivity, unhealthy weight, smoking, psychological stress, and excessive alcohol and drug abuse. And I think for many people, the idea of psychological stress being a risk factor for heart disease, some people think that it's more hearsay, or some people think that it might be more, what people talk about, but that there's not a lot of research on it. But actually, the past 40 years of research has really seen a big boom in support on the idea that life stress, chronic stress, daily stress really impacts our health and well-being and our longevity across the lifespan. So the take-home message so far is that the quality of our lives is equally as important as the quantity of our life, and that health behaviors and stress matter. But for some, it's worse. And Joanne Tate had mentioned the word vulnerable population. So what is the definition of a vulnerable population? So according to the Canadian Medical Association journal, or Canadian Medical Association, and they published this in 2018, is that they classify, and you'll see it in the yellow, that they classify vulnerable populations as those that experience adverse health outcomes compared with the general population by virtue of both internal and external factors. So it's not really that they're just unhealthy, but there's internal or external factors that are making them unhealthy. And those external factors or internal factors in the second yellowed part at the bottom, is that they seek to focus on groups for whom an additional factor such as poverty or isolation or discrimination or social disruption renders them vulnerable through inadequate delivery of effective health care. And when you think about the idea of vulnerable populations, we speak in Canada about Indigenous peoples. We speak in Canada about minority groups, invisible minority groups, or queer individuals, members from the LGBTQ community. We speak about women. We speak about those who are from low income. We also speak about older adults. Older adults is an area that has received a lot of attention on identifying that older adults really do face discrimination and social disruption and poverty and isolation, and they're also a vulnerable group. And if you look at Seniors First BC, which was formerly known as the BC Centre for Elder Advocacy and Support, they identify 3 risk factors that really contribute to the vulnerability in older adults. That's health status, their cognitive ability, and social network. So the poorer one's health status, the more disrupted their cognitive ability and the worse their social network, the greater their vulnerabilities, and that they've identified that in those who are especially over 85 years old have more vulnerability to exploitation or by institutions and individuals. One thing that we often speak about when we speak about vulnerable populations, we talk about the individual who is vulnerable. Caregivers are also vulnerable. Caregivers, family caregivers, are vulnerable to the same levels of isolation and poverty and discrimination and social isolation and lack of social support. There's difficulty for family caregivers as well. So let's look at some of the statistics about, and this was from 2012 from Stats Canada. So if you look at the first bullet, in 2012, 8 million Canadians, or 28% of the population aged 15 and over, were providing care to some family member or friends with a long-term health condition or a disability. Among these family caregivers, 39% were caring for a parent, 8% for a spouse or partner, and 5% for a child. Among regular caregivers, 38% of those who help their child report feeling depressed, and 34% who help their spouse reported feeling depressed, and 21% who help their parents were feeling depressed. Those are really high numbers compared to the general population. Among regular caregivers, 28% who cared for a child and 20% who cared for a spouse experienced financial difficulties, and 30% were receiving government financial assistance if they were providing care for a child, and caring for a spouse, 14% of them were. They also did a survey of psychological distress and health consequences in people who are providing care as a family member to a person who requires support. And what they found was that if you were providing care for a spouse or a son or daughter, the majority, well beyond if you were just providing care for a grandparent or friend, or even for a parent, the majority were feeling tired, worried or anxious, overwhelmed, alone or isolated, angry, and many of them were feeling unhappy, depressed, with a loss of appetite, sleep problems in the majority of them, and some overall they report that their health suffers as well. And this is not just a Canadian issue. If you look at the research from around the globe, you'll find research across the globe showing that caregivers have higher levels of depression, high levels of stress and frustration, higher levels of harmful behaviors to self and to others, harmful behaviors including alcohol use, smoking, and so on, have worse health, they have increased risk of heart disease, twice as high levels of risk of heart disease, lower levels of self-care, and have an increase of mortality rate by 63%. And the more hours that people provide, the worse all of these bullets actually are for caregivers. So the stress of caregiving is impacting their health, their diet, their activity levels, their weight, their smoking levels, their use of alcohol and drug use. These are all being impacted by stress. And actually, you can probably put arrows in between all of these boxes, kind of impacting each other. So, not to make light of it, but I put in a comic. So this person's prescribing exercise. Think of it as a stress pill that takes 30 minutes to swallow. When I think about, it's always a struggle for me when I talk about how do you help vulnerable populations and individuals who are vulnerable with exercise? How can, how dare I, and I tell myself this all the time, how dare I say that just movement will actually fix our health and well-being, because at the end of the day, caregiving and family caregiving, which is a significant burden on these individuals, is really an institutional problem. It's a problem where governments are not supplying enough funds. It's a problem where family members, there's usually one family member taking on the entire responsibility of family caregiving, while the other children or siblings or whatever it is might be providing a lot less. So there are some institutional issues that I cannot address, that I do not address with my research, but I try to provide and create some community programming and community support for individuals who are vulnerable and individuals who are feeling a lot of high chronic stress in their lives. And one of my studies was a big study that I ran in San Francisco, but I continued when I was a faculty there, but I continued running from here in Vancouver when I transitioned here 5 years ago. I continued running it in San Francisco, so flying back and forth a lot. And that study sought to provide family caregivers with an exercise program to boost well-being and to boost their health. But before I get into that, I do want to talk about the idea that walking is really man's best friend. We all hear about some of the benefits of exercise. So exercise and moving more does reduce dementia by 30%, hip fractures by 68%, depression by 30%, reduces all-cause mortality by 30%, and reduces cardiovascular disease risk, type 2 diabetes, colon cancer, breast cancer. Physical activity is the one of the most wonderful behaviors that has an impact across the entire body and mind. So this brings me to the study. So the study that I completed in San Francisco, called the FAST study, or Fitness, Aging, and Stress study, was directed towards improving the fitness and family caregivers. So for a 6-month period, and you'll see this red block, for a 6-month period, we provided support to family caregivers. Or not, so they were randomized to one or the two groups of either exercise support or asking them to kind of maintain their low levels of activity. We ensured that the participants who participated in our study were providing minimally 10 hours of care to a family member with Alzheimer's disease or with another type of dementia. We also ensured that they were high stress, so they reported higher than average levels of stress on a certain measure that is validated in the United States. And we also ensured that they were physically inactive, so they were not completing kind of the recommended CDC numbers of how many minutes of exercise they should get. In the beginning of the study, we oriented them, we enrolled them, and that's week 1. You'll see that on the left side. On week 2, we drew blood, we did baseline questionnaires, they filled out this thing called ecological assessments, and I'll tell you about them. And then they did their clinic visit, where we did a cardiorespiratory test, and which is like a heart stress test. And then we did all the same parameters at the end of the survey. This is one of we provided our participants a free membership to the Y, our participant on the left who provided us rights to use this and share this image, and our trainer on the right, who was a study appointed trainer who met with the participant at the beginning of the study, gave them a rundown of how the YMCA works, kind of our goals for their study, for their participation, what they're wanting from the study themselves, what their goals for the study, and then weekly kept updating them on what their progress was. So at the beginning of the study, participants from the first week to the 9th week, you'll see, let's say the first row, you'll see that we kind of recommended 3 sessions of 20 minutes to get to the gym or to get outside and do some sort of workouts. We also kept them at the low levels of the moderate intensity levels so that they don't burn out too quickly or hurt their muscles too quickly or get exhausted too fast. And we told them to do about 60 minutes over the week. So the goal is, of course, to get them to 150 minutes by the end of this, by the 9th week of the study. So not the end of the study, but by the 9th week of the study. But we slowly helped them and supported them to get to that by telling them to diversify, to get more days in, to get longer sessions in, and to increase the intensity and their targeted heart rate, to increase it more and more through the 9 weeks, and then to kind of stabilize it. The CDC in the United States and in Canada and across the globe does recommend 150 minutes per week of moderate to vigorous intensity. So that was our goal for them, but we knew that most of them would not be able to just immediately launch into 150 minutes after not working out for years and feeling stressed from caregiving. Every single week, we downloaded their data, their workout data, because they wore devices when they were working out, and we downloaded their data. And every single week, we would send them a report of how many moderate minutes they did, how many vigorous minutes, how many light minutes they did, and we would tabulate it. And as you can see at the bottom, they did 199 minutes, and we would send them this congratulatory email with this report, with all this colorful report that would say, congratulations on exceeding your 150 minutes. By 49 extra minutes this week, and we would give them a report that kind of showed what they did for the week. We would also include how they've been progressing throughout the whole study. And if they didn't reach the goal that we were hoping for, we would schedule a phone call. We would still congratulate them, because if your goal is 150 minutes and you do 20 minutes, it's still something to congratulate. It's still something to congratulate them for remaining in the study, even though they feel that they might not be reaching their goal. And we would call them and we would engage with them in a phone call to do this motivational interviewing, where we would talk about the facilitators and the barriers to being physically active, and what helped them get out for 20 minutes over the past week, what were the barriers, and what can they do about it, and come up with a plan for this coming week to get over these same type of barriers if they do appear. 4 times a week, we would send them text messages to remind them to be physically active, and we would typically send these text messages on the days that they said that they would be more likely to work out. So for example, here's an example. Today is a great day for a walk. Meet a friend for a brisk walk instead of coffee or lunch, etc. So what were the results? We published our first set of findings, I guess 2 years ago now, in a psychoneuroendocrinology. Aerobic exercise lengthens telomeres. So we focused on a cell aging mechanism. This article helped me win a Kurt Richter Award from the organization, from Society. So that was really cool and awesome and fun. So what was our success? So in the group that was randomized to work out, we had at the 150 minutes per week goal, we had a 74% success rate in having these participants on average work out, or 73% of participants worked out at the goal of 150 minutes on a weekly basis throughout the entire study. If we reduced it a little bit, because some of this activity was moderate activity and some of it was vigorous, but we reduced it just a little bit to 120 minutes. So instead of, let's say, 5 days a week of 30 minutes, 4 days a week of 30 minutes, what we found was a higher success rate at about 82% in attaining on a weekly basis 120 minutes of moderate to vigorous activity. We found that their cardiorespiratory fitness improved in the exercisers, so their heart got better, their lungs got better, and the control group did not change. They went down a little bit, but it was not a significant change. We also looked at this, so that's kind of like a traditional health marker. Yes, exercise works and it improves the heart and lungs, which makes sense. We also looked at this marker called telomeres, which is a cell aging marker. I won't get into too many details about it, but just know that the longer the telomeres, the healthier your immune system is, the more robust your immune system is. And I'll skip all this, but what we found was that in the control group, there was no change in the telomere length from beginning to end of the study, but in the group that exercised, we found a significant elongation of these telomeres. And that these differences, the elongation or the lengthening of the telomeres in the exercise group, was different as a change compared to the control group, so what we call a treatment effect. So it seems to also not just impact physiological systems like the heart and the lungs, but also seems to be impacting the immune system and cell aging marker called telomere length. We also found that there was a significant drop in their perceived stress. there was a drop of 5 points in the perceived stress in the exercisers, and the control group had a change of 1 point on the scale, and this difference was also significant. There was also a change in BMI where the waitlist group continued increasing in their BMI, whereas the aerobic exercise kind of stabilized. We just recently published, published like a few weeks ago, is the effects of exercise with the same data, but looking at some psychological functioning measures. So looking at their depression and their caregiver burden and their mastery. And what we found was that for the control group or the treatment group, their depression went down, their caregiver burden went down, and their sense of mastery, their sense that they are in control of things in their lives in general, also actually increased. Whereas the control group, throughout the 6-month period, kind of stabilized. Their depression didn't really change, their caregiver burden didn't change, nor did their mastery. We also tracked during their days, 6 times a day, how they were feeling throughout the day. And we did it at the beginning of the study for 7 days and at the end of the study for 7 days. So we tracked it on the first day, and then we would randomly assess all these different things, like how much control do you feel right now in your day? How much are you ruminating about bad things in your day? How are you in a good mood or are you in a bad mood? And what we found was that, and I'm just going to get through this really quickly, what we found was that for all exercise participants, or on average, all the exercise participants decreased in their rumination, increased in their sense of control, and decreased in how bad of a negative mood they were in from the beginning of the study to the end of the study on a daily basis in their daily lives as they were going about their daily business. Whereas for the waitlist group, their rumination didn't change, so how much they were dwelling on negative things repeatedly throughout the day, how much sense of control they felt during the day, did not change. And actually for that control group or the waitlist group who got the intervention at 6 months, for those participants, their negative affect actually went up, or their negative mood went up. So the take home really is that exercise improves these traditional and novel markers of health. Exercise improves how we experience our days, and understanding our motivation barriers and facilitators for health behavior change is potentially essential based on the study, because we were able to get participants to engage in physical activity on a weekly basis more than other studies typically find. So how much exercise is good enough? So this is where the tips come in, and this is what you might be here for. So the tips, according to the Canadian Physical Activity Guidelines for anyone listening who's 18 to 64 years old, is to achieve health benefits to achieve any health benefits, you have to engage in at least 150 minutes of moderate to vigorous intensity aerobic exercise. Also beneficial to add muscle and bone strengthening, and the more physical activity provides greater health benefits. So yes, it recommends 150, but if you do 300, there's evidence to show it exponentially is increasing your health. So they talk about intensity. So what does moderate intensity mean? According to CSEP, and according to, this is not just the Canadian Society for Exercise Physiology, but this is really the entire world talks about intensity. Moderate intensity is, makes you sweat a little and to breathe harder, and that's brisk walking and bike riding. Whereas vigorous activity is jogging and cross-country skiing. So you are sweating, not just sweating a little, but you are sweating a lot and you're out of breath. If you are 65 and over, you'll see they used to recommend different types of exercise or different amounts of exercise for 65 years and older compared to younger, but it's kind of consolidating on the same message. 150 minutes of moderate to vigorous, beneficial to add muscle and bone strengthening activities at least 2 days per week, and those with poor mobility should perform physical activities to enhance balance and prevent falls. So that's added in here for 65 years and older. So again, they give the same kind of examples of brisk walking and biking for moderate activity, and for vigorous activity, cross-country skiing and swimming. So what can I tell you as a tip for if you're not being physically active? So I'd say one of the first things that we have to start with is to explore our motivation and to explore whether we really want to do it. So one of the most someone asks me, people have asked me, how can I get more physically active? How can I take better health? I'm like, do you want to? And they're like, I don't know. I'm like, well, that's the first thing we need to know. Like, do you want to do this? So to exercise, for me to exercise, I want to get healthier. Some people might want to lose weight. I might want to grow my telomeres. I want to feel better because my research actually tells me, and also my experience of physical activities tells me I'm going to be in a better mood when I'm physically active, not just right after I'm physically active, but over the long term, if I'm physically active for weeks and weeks on end, I just feel much lighter in my mind. For many of you, you might want to be around for your grandkids or for your children, might want to feel more confident, want to live longer. My family wants me to be healthier, so those are some of the motivations. And what are the motivations not to exercise? I don't really have time, I have too much stress, I have no motivation, I'm too tired at the end of the long workday. Exercise is boring. Some people hate the gym, some people hate running. Some people don't know where to start, and so on. There's so many reasons, probably more reasons why not to exercise than why to exercise, really. So once we think through our motivation and we really can start balancing and having a tipping point where the pros of being physically active outweigh the cons of being physically active, or maybe they're equal, or maybe there's still more negative reasons, but it's much more important for you to take care of your health, then it's time to start planning. So it's weird to think about the idea that exercising, which should be fun, we also have to set some goals. So not just long-term goals of I want to improve my health, but short-term goals. I am going to be physically active 4 times this week. I am going to do it. It's going to make sure that it's specific. So I am going to use the app Down Dog, which is an app I'm going to tell you about shortly. I'm going to go for a walk for 30 minutes 4 times per week. It's measurable. I have my 30 minutes there. It was specific. It was exactly what I'm doing. It's attainable, so 30 minutes is definitely attainable. As opposed to, I'm going to go for a walk at some point today, and it's going to be, I think I'm going to maybe walk for about 3-4 hours because that's what my health needs. That's not as attainable for many individuals. It's realistic and it's timely. So it's time bound. So it's 30 minutes at 8 o'clock to 8:30. So they're called SMART goals. So setting a SMART goal around physical activity is actually really smart. This is my schedule. For example, I ensure that at 8 o'clock in the morning, every single morning I go down to the gym in my condo, and I use the gym 4 or 5 times a week for a 45-minute to an hour period. During this COVID pandemic, since I'm on council, I made sure that our gym stayed open and that only one person's allowed to use it at a time. So we have a whole sign-up sheet down there. But some people have told me that by having to sign up for that 1 hour block, they're actually using the gym so much more often than they were before, because it's no longer this vague, oh, I should go to the gym. It's more, oh, I put my name down on a piece of paper, I better show up. So calendaring it and putting in your calendar is essential. Be realistic and start slowly. Many people think that they're going to start being physically active after years of not being physically active. They think, I am going to go 6 times a week to the gym, or 6 times a week I'm going to go for a walk, and my walks are going to be an hour, hour and a half, and they're going to be in the forest, and they are setting these very big goals, which are really lovely and really wonderful. But on day 2, when you haven't gone on Monday and now you're on day 2 and you thought you have to go 6 days a week and you didn't go on Tuesday either, and then Wednesday comes along and there's no more 6 days left, there's now only 5 days to the week, but you said you were going to do 6 days, you now feel like a failure. So we should be realistic and start slowly, not only because it's good for our body to start slowly and not push our body into such an extreme that we don't like it, but it's really important to be realistic so that we don't feel deflated if we fail in quotation marks, because doing even a day a week is really great. So that's, for example, this how we set it in our study, which was start off slowly, 3 days a week, 20 minutes a day, and then move up. So you have to plan for barriers. What's going to happen if you don't go on Tuesday at 8 o'clock? What is your solution? You have to think, what is your solution? How are you going to fix it or change it if you can't go and something ends up happening at 8 o'clock on Tuesday morning? What if you're feeling stressed out and you just want to watch television. How are you going to motivate yourself to get off the couch and go for a walk? So you have to plan for these barriers and think through them and work through them and kind of practice them in your head, so that when these barriers actually you're facing these barriers, you end up being able to overcome them because you practice them in your mind. And really think about it on all the other things you've ever changed in your life, and all of you have changed things for the better in your lives on some topic, whether it's work, family, home, cleaning, how clean you are in your household, whatever it is, you've all changed it, and you've all faced some sort of barrier to those first steps until it became a habit. And it's the same thing for physical activity. So explore what you like to do. So they mentioned on that website, the CSEP website, join a weekday community running group, go for a brisk walk around the block after dinner, take a dance class. They recommend all these different, and you can, you'll have these slides so you can go and look at the website from CSEP. But COVID-19 is offering these weird challenges where not only is it challenging if you're not typically active, but if you're mandated to stay at home and everything's closed, how are we supposed to join a gym class or a dance class? So it does offer a lot of challenges. So most of those on the list are things we cannot do other than going for a walk, maybe raking the lawn if you don't live at a condo, going for a nature hike on the weekend, taking the dog for a walk. Even hanging out with family until recently was a no-no in the province. So we weren't even able to go and be active with someone that we liked or that we were related to, who might be someone you like or not. So how, it becomes more of a challenge. So we have to become more, we have to come up with different solutions. So really, I think at this point for all adults, I think going for a walk and going for a brisk walk in nature on the seawall or wherever you live is probably the best solution for your health. There's also apps that you can download, like the 7-minute workout challenge. This one's a bit more difficult than this was, the 7-minute workout. They say within 7 minutes, if you do these 7 or 10 activities, you're going to be more physically fit, which is true. It's based on research. The Johnson & Johnson app is fantastic. If you want to work out at home, this Johnson & Johnson app has the 7-minute workout, the full workout, the beginner workout, so that's even easier, an intermediate level, strength workout. So they have all these different, from easy to moderate to high intensity types of 7-minute workouts. So you can really start on the easy end if you want to be working out at home. I've partnered, and I'll tell you about it in a moment. There's this app called Down Dog. The models, it's a video, so you're watching videos of people working out. Every time you work out, it's a completely different video. But there's yoga for beginners, there's high intensity interval training, there's the bar class, there's a 7-minute yoga, and there's also prenatal yoga if you know of any pregnant woman. So, there are apps everywhere that really that you can download and work out from home. So here's Choose Your Practice on that Down Dog app, and you can be a beginner yoga person, and you can only do it for 10 minutes if you want. So it's really helpful to help people start slowly from their home. And you should diversify your portfolio. That's what I like about the Down Dog. You can do yoga, you can do HIIT, you can do bar classes. So every day is a whole completely different experience. You should include a walk in there. You should try and diversify your activities. And create memories. So one of the most important research out there shows that if you remember at the end, so everyone does a bout of exercise, and if you stay in the moderate to vigorous level, you're actually feeling really good at the end of it. And if you can remember how good you felt at the end of that bout of exercise and make it an explicit memory, it will motivate you to become more physically, or to engage in another bout at another time. So just remembering that it felt really good is really important. During it might not be the most comfortable, but most everyone feels better after. And you should adapt. So this is how many of us think. If at first I don't succeed, then I just suck. I can't be physically active, but that is not true. You just have to redefine your goals. If 150 minutes doesn't work for you, bring it down to 30 for the week. Be realistic, schedule it, identify your barriers and what helps you. Remember your motivation and also the good times, and bounce back and try again. And that's the most important. So just to wrap up, I just want to identify 2 studies that we're doing at UBC. You might be interested in participating. One of them I'm the principal investigator on. if you're between 18 and 64, or if you know people between 18 and 64, we're using the Down Dog app, and people will be either doing yoga or high intensity interval training for 6 weeks at home during this pandemic to improve physical activity levels, but improve well-being during this stressful time. And then this is probably more in line with for many of you, if you're 65 years and older. It's a 12-week program to increase levels of physical activity at home. And this is from my colleague, Dr. Mark Beauchamp, and I'm one of the investigators on this one, and it's called the Seniors COVID. So mine was called the COVID pandemic, the COPE trial, and his is called the SCOPE trial. And this is for older adults to be physically active at home using their computer on either live classes with an instructor on live or to be or get videos that are just in a folder online that you can download and use. And with that, I just wanted to thank you. Thank my funders who helped build my lab and all the people who supported my caregiving study in the United States. And that's it. Thank you very much.
Thank you, Dr. Puterman. What a great presentation, and I have to say, really informative and motivating. And I think that's what we often hear when we talk to people about being at home, is how you can get one's physical activity going, and motivation is a big thing. But I love the way that you talked about how not to sort of get discouraged if it doesn't work one day or the goal seems too big, but just to keep doing something and keep moving forward. So that's great. Thank you so much. We have a bit of time for questions. Christine is going to help us with those. And again, please raise your little right hand or your button on the right hand side, or type in a chat question. So Christine, what do we have for questions?
So I'm going to unmute. We have Donna, and Donna, I'm going to unmute you there. You can go ahead and ask your question.
Can you hear me?
Yeah,
we can hear you.
Oh, thank you very much, Eli. I facilitated occasionally too, and you did a great job today. But you fired off the SCOPE trial too fast. I'm interested in being involved in that. Could you give that email again?
Yeah. So
what about an old-fashioned phone number?
Old-fashioned phone number. Let me tell you the old-fashioned phone number. Actually not on here, but if you go, you can email kin.scope. So kin as in kinesiology, KIN .scope, SCOPE at ubc.ca.
Yeah, great.
Just email them that you're interested.
Thank you.
In the study. You can also look for more information to see if you're eligible by looking at scopetrial2020.ca.
Okay.
If you want to just get a bit more information about the study, about the different randomization procedures and whether you're eligible or not, and so on. So definitely, if you're interested in it, I would contact. It's a really, Mark Beauchamp, my colleague, you may have heard a few years ago of someone who started at the YMCA's a program for older adults, teaching older adults aerobic exercise, leading to like more attendance at more classes at the YMCA because it's older adults teaching older adults. He was the PI of that study. When the study ended, there were so many people who were so angry that the Y ended the classes because the study ended, that the Y actually created an entire like now you can go to YMCA's and have those kind of classes. So he's been focused for a dozen years on maintaining the health of older adults in Canada.
And Eli, one more question. You just focused on caregivers. Is anyone doing research on just the people like who have grandchildren and children that you're inherited for the rest of your life? Those kinds of things, not caregivers, but people that are dealing with the reality of life.
Oh, right. Not in terms of physical activity. I don't know anyone.
Okay.
So there's a lot of research in health psychology looking at parents who are providing care to children with health conditions, physical or mental health conditions. So there's a lot of work on that. Most of the research in health psychology has really focused on like social support mechanisms or even mindfulness techniques. I can't think of any that has looked at physical activity levels and in changing physical activity. My next study that I've just proposed isn't with caregivers. My next study is vulnerable women living with HIV, and creating a dance program at local organizations to try and use dance to kind of create social cohesion and reduce isolation and improve health and well-being in women living with HIV. So once that starts, I'm going to probably propose another family caregiver study soon enough to keep that track going also.
Awesome, thank you. Eli, the next question is, what are your guidelines for seniors over 75 and up for exercise?
They're the same as for 65 and up. It's 150 minutes they suggest. They suggest using, moving their muscles and bones twice a week minimally, and also doing flexibility types of workouts. When we think about moving your muscles and bones, like I used to lift heavy weights because, you're in your 20s and 30s and that's what you want to do is have bigger muscles. For the past 2-3 years, all I've been doing is workouts that using the Down Dog app or other apps that I've used in the past that just make me balance on one foot, or make me balance on one foot and then bend over and touch my toes and do some squats. And all those are really great for flexibility. All of them are really great for improving cardiovascular health as well, because when you're doing a squat up and down, you're not just balancing, but you're also increasing your cardiovascular function and also your heart rate and your lungs capacity, and you're needing, it's aerobic exercise at the same time as doing flexibility. So that's what's really great about some of these apps I suggested, like Down Dog or and the 7-minute workout, is that it's kind of working on all of these different pieces at the same time: the muscles, the bones, the flexibility, and finding one that's right for older adults. I would stick with the Johnson & Johnson one. That's the one when I did a big search online for seniors. It was recommended that the Johnson & Johnson one is the best for seniors or older.
Awesome, thank you. Now we have another question here. How do we create and fund a model whereby the 24/7 caregiver gets 5 half days of home and night nursing support, so there's actually time for rest, exercise, self-care, etc.?
Can I turn that over to Maria?
It's a great question, and certainly it's one that requires many partners coming together to support, so that respite and programs for people living with dementia can also be participating in, and hence the program, the Minds in Motion program that the Society runs, and other exercise programs that are run, such as through UBC, are so important so that people can have a chance to get the rest they need to exercise, but also people living with dementia can have an opportunity to exercise and have the social interaction as well.
Thank you, Maria.
Okay. Well, again, what a great session, and thanks, Dr. Puterman. I mean, it's just a lot of good information to think about and consider, and it is very promising to see there are so many options that are being made available for people to help them depending on their situation, and certainly technology has made a big difference in making that availability. But as you said, it's still the internal motivation that often can be our biggest barriers. So, the ability to use apps where there's motivations from other people is so important. I just thank you so much for your presentation today, and also a big thanks to the sponsors who have joined us, and Providence Healthcare for putting on the Dialogue on Aging. It's our second virtual session in the series, and next in 2 weeks on June 25th, we will have the third at 1 p.m. So we really hope everyone who joined us today can join us again on the 25th. And I believe there's someone actually from way out of town joining us today from down in the US. So that's really exciting to have an international reach here. And on the 25th, we're going to hear from Dr. Julie Robillard, a very well-known name as well, from UBC, and she's going to talk about a presentation called "The Future is Here: Choosing New Technology to Help with Healthy Brain Aging." And many of you who may know Julie know she also has a passion for robotics. So I know that's going to be another great session in the series. So thank you again for joining us. This session has been recorded and will be up on the public website of the Dialogue on Aging in a few days. And so we welcome you to go back and take a look. And I know too that if you need to contact Dr. Puterman through his address with UBC, I'm sure he'll be willing to help share some more resources if necessary. So thank you again. And in the words of Dr. Bonnie Henry, I'm going to borrow, be kind, be calm, and be safe. Thank you, everyone.